Hello everyone. In this narrated presentation, we're going to talk about a concept we're all familiar with, but may not have context in a clinical setting, and that's stress. Let's go ahead and get started. There are three main types of stress responses. The first is a positive stress response, which is actually a normal and essential part of healthy development, characterized by brief increases in heart rate and mild elevations in hormone levels. Some situations that might trigger a positive stress response are the first day with a new caregiver or receiving an injected immunization. Then you have tolerable stress response, which activates the body's alert systems to a greater degree as a result of more severe, longer-lasting difficulties, such as the loss of a loved one, a natural disaster, or a frightening injury. If the activation is time-limited and buffered by relationships that can help the person adapt, the brain and other organs can recover from what might otherwise be damaging effects. Which leads us to toxic stress, which can occur when a person experiences strong, frequent, and/or prolonged adversity, such as a physical or emotional abuse, chronic neglect, caregiver substance abuse or mental illness, exposure to violence, and/or the accumulated burdens of family economic hardship without adequate support. This kind of prolonged activation of the stress response systems can disrupt the development of brain architecture and other organ systems and increase the risk for stress-related disease and cognitive impairment. So let's get into a little bit more granular detail about toxic stress, since it carries the highest risk to the clients you could be working with. Toxic stress, remember, is the repeated long-term use of the body's stress response system with the absence of stable support to buffer that stress. Risk factors for toxic stress include extreme poverty, severe maternal depression, family violence, and many other examples. From a community health worker's perspective, it's important for our practice to take a professional neurotrauma lens view of stress. Toxic stress and trauma exposure is comprised of neurobiological functioning, which includes emotions, thought processes, behavior, sensory, and somatic experiences in your clients. And a person's environment can promote, inhibit, or exacerbate those effects. So a community health worker can be influential in increasing your client's physical and emotional safety, minimizing activating the client's trauma-based neurobiological response patterns, and taking a trauma-informed care approach at all social work agencies. This environment really makes a difference, so you have a lot of opportunity to help people with toxic stress as a community health worker. So again, biology is important and needs to be considered. We need to have higher level thinking and understanding that toxic stress is not simply just a choice or a switch that can be turned on or off. It has physiological effects on the body. Community health workers need to understand their clients' thought, behavior, cultural, social issues, and emotions are all interconnected, and that toxic stress prevention is primary prevention. We want to get in there and be developing programming and building connections for our clients before they're in a situation where toxic stress is taking over their lives. We also want to prevent the symptoms of toxic stress for those already experiencing toxic stress by developing additional programming and working with partnerships and medical professionals to ensure that our clients are getting the care and treatment that they need. We also want to always be utilizing evidence-based practice, making sure that what we're doing has backing from more than just our own opinion, but from a peer-reviewed medical community.